The Reproductive Health Suppliers Coalition, in collaboration with Ghana Health Service, has brought its members together as they reflect on the pandemic impact on money, related markets, and supply chain and movements, drawing lessons from how sectors respond and celebrating its unique resilience.
Leverage catalytic investments into groundbreaking outcomes. We champion research, investigation, and thought leadership. We seek and provide the evidence and the data for supplies-related decision-making, and we ensure that RH supply security remains very high on the global agenda, and by providing a forum for the bold leadership of our members, as together we develop joint strategies, activities, and tools that move that agenda forward. And above all, we seek, as the coalition, to be of service to our members in everything we do. Thank you very much indeed.
Speaking at the general membership meeting of the Reproductive Health Suppliers Coalition on Thursday, 19th October 2023 in Accra, Martin Smith, director for the Reproductive Suppliers Coalition, said the disruption during 2021-2022 of the supply chain during the pandemic called for the need to play the long game.
Martin Smith, I'm the director of the Reproductive Health Supplies Coalition. We're the largest organisation of reproductive health supplies organisations in the world. We have over 570 members, plenty of whom are here in Ghana. We have members coming from governments, Ghana Health Service, for example, from manufacturers, from civil society organisations, from donors, and from a wide range of grassroots organisations all over the world. We work together on the big supplies, procurement, distribution-related challenges for the broad range of reproductive health supplies, including contraceptives, including maternal health medicines, and of course menstrual health products as well. And we've had a tough time, let's not forget, and Claudette set this out so very well earlier on, Claudette Diogo from the Ghana Health Service. We've had a challenging 4.5 years. This very meeting was meant to be here in Accra in October of 2020. We put it back by 3 years, but of course the focus of our meeting has very much centred around resilience, as Claudette has been saying to you. And the innovation that resilience that we've needed to show during COVID-19 is a great positive for our community. There was obviously a terrible tragedy that pandemic happened, and yet the innovation that countries showed, and the innovation that Ghana showed particularly, in the leadership role among our countries that they had in assuring access to reproductive health services and supplies during the pandemic, those lessons in preparedness for difficult times, that ability to do more with less, quite frankly, are lessons that our colleagues from Ghana and from all over the world are teaching each other, and they're learning from each other during the course of the 5 days of our HSC's GMM. So with that, I'm happy to take any questions. I would say one more thing, which is that I am no stranger to this region. This is my 9th trip to Ghana. I love the country deeply. I worked in Sierra Leone for several years in delivering sexual and reproductive health services in Freetown and in Sierra Leone just after the Civil War. And so this is a region I care passionately about, and I'm so very delighted that this marks.
Dr. Marin Marthy, Head of Bilateral Resource Mobilization and the Ministry of Health, said Ghana Health Service during the COVID-19 did not stop providing reproductive health service despite the COVID-19 and its challenges.
One key element of any kind of public health programming or zooming into reproductive health or family planning is the presence of commodities. So one thing that really hit hard was the fact that commodities had to be coming in. But it's a joy to note that at that time, we did not suffer a lot of stockouts as would have been. Immediately, we had to look at strategies of redistribution across the country, and this made sure that we were not having a lot of stockouts in the facilities. And well, with the adolescents, we realized that it's very key that we have them on board in making sure that they get the right information, because according to our objectives, our family plan, we want to make sure that they get the right information, and those who are sexually active, we provide the service. So with that challenge on that side, we try to mitigate the challenge by making sure that commodities were available and making sure that we were giving them the right information, and then they were able to access the service wherever they find themselves. And in terms of funding, well, I guess funding has always been an issue wherever you find oneself, especially in this part of the continent. And so that is where our advocacy becomes very strong. When you look at our FP 2030 commitment, we continue to work with our partners to see how they can be able to come on board to be able to help us in procuring our contraceptives. And of course, government has also gone ahead to make a commitment to increase its purchase of commodities across the country. So hopefully the resilience is what it is, but we're finding ways to make it happen. Yeah. We continue to make sure that our quantification or forecasting is on tops. We looked into cognizance what our data says, and of course it's a joy to let you know that our logistics management information system has been linked to what we call the Global Family Planning Visibility Analytic Network, which actually helps us to be able to have end-to-end visibility into our stock situation. And that GFP van creates a platform where we have donors, manufacturers, we have decision makers all there. So as soon as we realize that there is any shortfall, we tend to communicate up there, and then immediately we advert any form of issues that come up, be it stock outs, or should we realize that there is any form of overstocks which could lead to expiries, immediately we use this platform to make sure that we are ensuring commodity security in country of commodities across the country. So hopefully the resilience is what it is, but we're finding ways to make it happen.